IBS is extremely common. Bowel cancer is also more common than most people realize, and the symptoms overlap. That combination is one of the most genuinely confusing situations people face when something does not feel right with their digestive system. I want to be clear from the outset, most people with bowel symptoms do not have cancer. The vast majority of the time, gastrointestinal complaints have entirely benign explanations, but there are specific patterns, specific combinations, specific changes that doctors are trained to identify as warning signs requiring investigation. By the end of this video, you will know what those are. My name is Dr. Victor Hayes. Let me start with what IBS actually is, because understanding it properly helps you recognize when something has changed. IBS, irritable bowel syndrome, is a functional bowel disorder. That means there is no structural damage, no physical abnormality, no inflammation. If you examine the bowel of someone with IBS using a camera, it would look completely normal. The bowel is working. It is just not working smoothly. The diagnosis is made based on the pattern of symptoms rather than by finding anything on a scan or blood test. What does that pattern look like? Recurrent abdominal pain, pain that keeps coming back, often crampy, often in the lower abdomen, that is connected to using the toilet. Either the pain comes on when you need to go, or it eases when you do. Changes in bowel frequency or consistency, going more often, going less often, looser stools, or periods of constipation, bloating, that uncomfortable distension and fullness that builds through the day and typically eases overnight, mucus in the stool, which causes understandable worry but is actually far more commonly associated with IBS than with anything sinister. Critically, IBS is typically a long-standing, fluctuating condition. It waxes and wanes. It is better sometimes and worse at others. Stress reliably worsens it. Specific foods, onions, garlic, beans, wheat for some people, trigger flares. The pattern is variable and has been present for months or often years. The most important distinction in the whole of gastrointestinal medicine is this: IBS is characterized by variability. Bowel cancer is characterized by persistent change. Now let me explain what bowel cancer actually looks like in its early stages. Early colorectal cancer often produces symptoms that appear entirely ordinary. Change in bowel habits, blood in or on the stool, abdominal discomfort, fatigue. These are the same symptoms that bring people to their doctor for dozens of benign reasons. The cancer is not distinguishable from IBS by any single symptom in isolation. What distinguishes it is the pattern. When symptoms are caused by a growing tumor, they have specific characteristics. They are new, they are persistent without remitting, and they are progressive. A tumor growing inside the colon physically obstructs the bowel lumen. Depending on its location and size, it slows transit or speeds it, creates a sensation of incomplete emptying, alters stool consistency. The pattern changes because the anatomy has changed, and it stays changed. Here are the specific features that lower my threshold for investigation when they appear in combination. Rectal bleeding that is new. Blood in or on the stool that has not been present before. Yes, hemorrhoids are the most common cause of bright red rectal bleeding, and they are extremely common. But hemorrhoids do not always explain rectal bleeding, and new rectal bleeding should always be assessed rather than attributed to the most common benign explanation without checking. Blood mixed through the stool, rather than just on the surface or the paper, is particularly important to investigate. A change in bowel habit that is new and persistent for more than 3 weeks without a clear explanation. Not one-off variation. A sustained shift from the person's normal baseline. This is the symptom most commonly dismissed as IBS or stress, and most commonly responsible for delayed bowel cancer diagnosis. Abdominal discomfort that does not follow the variable trigger-linked pattern of IBS. In bowel cancer presentations, the discomfort tends to be more persistent, less obviously linked to specific foods or stress, and progressively present rather than coming and going. Unexplained fatigue or weakness, particularly the kind that does not improve with rest. A tumor can bleed slowly enough that no visible blood appears in the stool, but fast enough to deplete iron stores over weeks and months. That iron deficiency causes anemia, which presents as profound fatigue, breathlessness with activities that were previously manageable, pallor, and sometimes a racing heart. This is particularly important for right-sided colon cancers, which may produce minimal bowel habit changes, while anemia is the primary presentation. Unexplained weight loss. Losing weight without trying, without changing your diet or activity, without an obvious explanation. More than roughly 5% of body weight over a few months is always worth medical attention. A sensation called tenesmus, the persistent feeling of needing to go to the toilet even when nothing is there, or feeling of incomplete emptying after going. This happens when a tumor in the lower colon or rectum creates physical pressure that the bowel interprets as a signal to empty. It can come with urgency, and then when you do go, very little passes. This symptom, sustained over weeks, is specific enough to warrant prompt assessment. Now I want to address the psychological trap that catches many people with IBS, and I think this is one of the most important things I can say in this video. If you have been living with IBS for years, you already have an explanation for every bowel symptom you experience. Every change gets filed under IBS. Every new development gets normalized by the existing diagnosis. This creates a real risk, a meaningful change in your symptom pattern, a change that in a person without IBS would trigger immediate concern, gets absorbed into an existing framework and dismissed. If you have IBS and you notice something genuinely new, blood in your stool when you have never had it before, a sustained change in your normal bowel pattern that has lasted for more than 3 weeks, unexplained weight loss, profound fatigue without an obvious cause, please do not assume it is just your IBS behaving differently. Treat it as a new symptom that deserves fresh assessment. The framework I would offer for any bowel symptom: if it is new, if it represents a genuine change from your personal normal baseline, and if it persists for more than 2 to 3 weeks without a clear explanation, speak to your doctor. Not because it is likely to be cancer, in most cases it will not be, but because it deserves proper assessment rather than ongoing self-monitoring. If you are over 40 and have not been screened, speak to your doctor about what bowel cancer screening options are available to you. Screening exists precisely because the early stages of bowel cancer are asymptomatic, and finding it early is what makes the difference between an 80 to 90% 5-year survival rate and a much lower one. The people who do well with bowel cancer are almost always the people who acted on symptoms early rather than waiting for them to become undeniable. By the time symptoms become undeniable, the window of easy treatment is often already closed. If this was useful, please subscribe to this channel and share it with someone who needs to hear it. I will see you in the next video.